présenté à l'ARVO 2025 avec Robert Whirthlin, qui a étudié, qui nous présente un poster sur le PDP, la Platform Delivery System. Robert, it's yours.
Hello, thank you very much for listening to my presentation. What we're looking at is the impact of the port delivery system treatment and study of eyes versus anti-VEGF injection in fellow eyes, efficacy and outcomes in patients with bilateral diabetic macular edema. This was a post-hoc analysis of the Pagoda clinical trial and asking the questions, well, how do the eyes of the patients who receive treatment only as needed compare to the eyes that got the port delivery device? And so what we'll look at is the study design. They got 4 loading doses, then they had their implant, they had these visits where they could get supplemental treatment, they had refills, 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 and comparing that to their other eye that got treatment on an as-needed basis. What we see here is that visual acuity results were good for both. The eyes that received the port started out a little bit worse, and they had a little drop at the time of the surgery, but by the end, they were the same. Anatomically, though, the eyes that received the port delivery system did better by the end, such that there was a 50 micron difference comparing the eyes that got the port delivery system versus eyes that had an idealized form of as-needed treatment within the framework of a clinical trial. A greater proportion of the patients who got the port delivery system had a 2-step improvement in their diabetic retinopathy compared to eyes that were treated only as needed, and no patients developed proliferative diabetic retinopathy, whereas 4 patients, or about 3.5%, in the fellow eye treatments progressed to proliferative diabetic retinopathy. Safety, there was no observed difference in terms of safety between the 2 groups as far as severe adverse events.
And all that with 8 procedures, but without the 5 first ones, you have only 3 refills.
3 refills.
Okay. And the other eye has?
The other eye, on average, they had 12 injections, okay, but there was a large standard deviation of almost 8. So you can see the spread where, you know, some patients had 1 and some had 29.
Okay. Okay, thank you.